So ovarian reserve means the quantity and the quality of the little primordial follicles on your ovaries. And what does poor ovarian reserve means that this quantity of the follicles in the ovaries is reduced in a woman of a reproductive age group. And it is quite important. It's an important cause of infertility for a lot of couples who are trying to conceive. So what causes poor ovarian reserve? Obviously, if you have been diagnosed with poor ovarian reserve, then you will start thinking, why is this me, and why I'm suffering from it? What could be the cause of it? Firstly, I would say that lots of times, and many of the times, even after doing plethora of tests that we have available, we might not find a reason that why you are suffering from having a poor ovarian reserve as compared to somebody else. But there could be primary. The most important thing is it is age related. So with the decline, with the advanced age, women after 37, 38 do experience decline in ovarian reserve, which is expected. That is what a normal mechanism of the body is. Other important category will be women who have got any cancers or having treatment with chemotherapy or radiotherapies, and that can affect the fertility of a woman or decline the ovarian reserve. Or if you've had any surgeries related to any cysts or any kind of surgeries, that can affect as well. Other things like genetic causes, syndromes like fragile X are associated with diminished ovarian reserve. There are certain autoimmune disorders. Other common things that we see, sometimes pelvic infections, even tubal diseases, or smoking, which can affect your quality as well as quantity of your eggs. So very important about lifestyle as well, which can affect your ovarian reserve. In particular, there might be you might not have any symptoms, and you might not realize that your ovarian reserve is declining. It could be you might realize that you're having difficulty in falling pregnant when you're trying to get pregnant, or if there's been a change in your cycles, your menstrual cycle has become later, or cycles have become shorter, or your bleeding has become very much heavier, or if you did get pregnant after trying for some time and it led to a miscarriage, can also indicate poor ovarian reserve, because poor ovarian reserve is also related to to the decline in the quality of the eggs. Sometimes, obviously, when we're talking about ovarian reserve for women who come into the menopausal category, you could feel hot flushes, night sweats, and those sort of symptoms as well. What we do is we assess the ovarian reserve by doing a pelvic scan or ultrasound scan, where we look at the ovaries and count the number of little anterior follicles that we see on your ovaries, and also do a blood test of AMH, which is anti-Müllerian hormone. These anti-Müllerian hormone is considered as quite a reliable biomarker in terms of assessing ovarian reserve. We put the two together, and we will then be able to conclude if you are average, lower average, or you have a good ovarian reserve. Obviously, the other blood test that we can do, or the hormone that we can test, is FSH. Now, FSH is inversely related, so that means higher the FSH, high FSH in the first 5 days of your cycle. It is cycle related. It has to be done at a particular time in your cycle, and so high FSH in the first 5 days can indicate lower ovarian reserve. So overall, ovarian function, it is something that happens naturally. It is what your body is has a control. So we as outsiders, we cannot actually control or improve the ovarian function. What we can suggest is somebody who is struggling to conceive and who is, if you are a healthy couple, you've tried for a whole year having unprotected sex and you've not been able to get pregnant, please do come and find out more about yourself, assess your ovarian reserve. And if you are in the category which your reserve is lower than expected, you might benefit from assisted fertility treatments like IVF or IUI, whatever will be based as a couple for yourselves. We will assess that. Some studies have claimed DHEA, which is a testosterone derivative, can be helpful or is seen to be helpful in increasing the follicle count and for the ovaries to respond and have, some of them have claimed natural pregnancies also after having this course of DHEA for roughly around 3 months. But I would insist that if you have been trying and you have been trying for 1 year, having regular intercourse, and if you've not been successful, just come and find out more about your fertility status at the moment and seek the help at the right time when we are able to do something. There are plenty of different protocols, plenty of different treatments that can be offered to you based on your personal reserve.